Hello and welcome to my YouTube channel. In today's video, I will be talking about amyloidosis. So let's get started.
Amyloidosis is a group of disease in which abnormal proteins known as amyloid fibrils are deposited extracellularly between the cell in various tissues and organs. It results from the deposition of toxic insoluble beta sheet fibrillar protein aggregates in different tissues, resulting in disruption and impairment of organ structure and function. It affects multiple body organs and systems. There are about 36 different types of amyloidosis, each due to a specific protein misfoldings. 19 are grouped into localized form and 14 are grouped as systemic forms. Coming to the structure of amyloid. Amyloid forming protein aggregates into distinctive fibrillar forms with a beta sheet structure. On X-ray crystallography or infrared spectroscopy, cross beta pleated sheet structure is seen, and on electron microscopy, amyloid appears as non-branching fibrils with 7.5 to 10 diameter and indefinite length. Types of amyloidosis. There are various types of amyloidosis. Here I have enumerated some of them, which are AL type of amyloidosis, also known as primary amyloidosis, which usually affects heart, kidney, liver, and nerves. AA type of amyloidosis, commonly known as secondary amyloidosis, and is usually triggered by an inflammatory disease like rheumatoid arthritis. It most commonly affects the kidney, liver, and spleen. Hereditary or familial amyloidosis. It is an inherited disorder which often affects the nerve, heart, and the kidneys. It's most commonly happens when a protein is made by liver is abnormal and that protein is transthyretin. Another form of amyloidosis is senile systemic amyloidosis, which occurs when transthyretin protein made by liver is normal but it produces amyloid for unknown reasons. It tends to affect men over age of 70 and often targets the heart. It can also cause carpal tunnel syndrome. Localized amyloidosis is a amyloidosis which has a better prognosis than the other varieties which affect multiple organ system. Untypical sites for localized amyloidosis include bladder, skin, throat, and lungs. Talking about pathogenesis of amyloidosis. Main amyloid proteins are AL protein, AA protein, and ATTR or transthyretin protein. The deposition of these amyloid proteins occur due to various conditions. For example, whenever there are normal proteins when produced in abnormal numbers because of an acquired mutation, monoclonal B lymphocyte proliferation happens, which causes increase in the number of plasma cells, which causes increase in the immunoglobulin light chain deposition. When undergo incomplete proteolysis, cause deposition of AL type of amyloid protein. In cases of chronic inflammation due to macrophage activation, IL-1 and IL-6 are are secreted, which causes increase in the serum amyloid associated protein, which undergo incomplete proteolysis to form AA type of protein and deposition of AA type of amyloid. And when there is production of normal amounts of mutant protein, for example transthyretin, then there is aggregation of ATTR protein and it causes deposition of amyloid in extracellular tissues. Coming to the diagnosis part of amyloidosis. For diagnosis, usually a tissue biopsy is required, which is generally from the rectal mucosa or the abdominal fat pad biopsy. And the stains which are specific for amyloid include Congo red, crystal violet, periodic shift stain, thioflavin T and thioflavin S, HNE stain, and IHC can also be done for diagnosis of amyloidosis. In H&E stain, the amyloid is pink and hyalinized and homogeneous. In PAS or periodic acid stain, the amyloid looks pink. Crystal violet stain gives a salmon pink color to the amyloid. And Congo red stain, which is the most useful stain in the diagnosis of amyloid, gives it a pink red color, which on polarized microscopy makes the amyloid protein appear apple green. Coming to specific amyloidosis. Amyloidosis which affects the kidney. Well, amyloid can harm the kidney's filtering system. This affects their ability to remove waste products from the body. It can eventually cause kidney failure. It is the most common form of systemic amyloidosis, and kidney is the most serious form of organ involvement. The earliest change which is noticed in amyloidosis of the kidney is the thickening of the glomerular basement membrane. And after that, there is deposition of acellular eosinophilic material within the glomeruli, tubulointerstitium, and vessel walls, as seen in this image, where you can see the deposition of amyloid in the glomeruli, which is stained by the past stain as pink. Here in the image, I have described how it looks. Next to it, I have shown under the polarized microscopy the deposition of apple green birefringence as amyloid deposits. Coming to the amyloidosis of liver. Well, in liver, amyloid deposits first appear in the spaces of disc. Normally, the liver function is usually preserved. As you can see here in this image, I have shown amyloidosis, which is usually seen as pale waxy area corresponding to abundant amorphous lightly eosinophilic amyloid deposits, which can be confirmed by apple green birefringence on Congo red stain combined with polarized microscopy. Coming to the amyloidosis of the spleen. Well, in amyloidosis of spleen, there are two different types of pattern, a sago pattern and a lardaceous pattern. Sago pattern, the cut surface shows characteristic tapioca-like granules, also known as sago spleen, and in lardaceous spleen, amyloidosis involve splenic sinuses extending to splenic pulp with formation of large sheet-like deposits. Coming to the amyloidosis of heart. In heart, amyloidosis can produce arrhythmia due to deposition in the conduction system. Amyloid first deposits in the subendocardial areas of atrium. The most common cause of death in cardiac amyloidosis is cardiac failure. The AL amyloid binds and inactivate factor 10 also can cause bleeding disorder. Here I have enumerated some different types of amyloidosis with the proteins involved and the organs affected. To summarize, amyloidosis are of different types. Most commonly are AL protein, AA protein and beta amyloid protein. Other forms are transthyretin, beta 2 microglobulin and serum amyloid P protein.
Hope you all understood the lecture well. See you in the next video. Bye for now.